My name is Melissa Richards. This will be my presentation based on venipuncture and capillary puncture. So firstly, what I will do is get myself organized before my patient comes in, such as washing my hands, get my stuff prepped and in order. Pause. So one of the standard procedures, we have to wash our hands and mask up and gloves off and all these things. So I'm gonna head over here. And also in my room, as you can see, in the phlebotomist room that is, we have our sharps container, our normal garbage, and we have our chair. We have everything that we need to get our patients in order and to prep. So let me just dry my hands off. And I will my face mask, some gloves, I have my tourniquet, so let me just go ahead and set up my stuff for the next patient.
Good afternoon.
Hi, good afternoon. My name is Melissa Richards. I will be your phlebotomist for today. Can I get your form? Can you please verify your name for me?
My name is Miss Melina Frank,
And your date of birth?
the 5th of May, 1971.
Can we have a seat?
Thank you.
And your bag needs. Great. So based on her chart from the doctor, it's saying that she have to do a LFT, that is a liver function test, and a KFT. So with that, we will have to use a red top to draw her blood. That is this one here. Now, and she have to do a capillary with some, we have to do a capillary puncture for her also. Now, which hand are you comfortable being bull runner for blood? What hand do you normally use to draw blood for you? This one. Great. So what we will do, put on our tourniquet, because we have to feel for her vein. That is basically 2 inches away from the thing. It's a little small, so it's rolling a little, but it's not supposed to be rolling. It's supposed to be flat. Please make a fist. And you take your index finger and palpate. Now in this case, this is the vein that we will be using. Great. We will be using 70% of alcohol with a cotton. Clean the area. As you can see, the vein is a little more visible. For us to take it, release your fist. Throw this away. Retie. Why is that is airing? We do our retie. I'm gonna be opening up my needle in front of her so she can see that it's very new. pull back my safety, uncover it, make your face, and then we will enter. Now once we enter, we have to take our tube, insert it, and the blood will run into the tube. Once that is finished, we untie there, remove our tube, place it back here, ask the patient to release her fist. Make sure that our safety is up and straight into the sharps container. Actually, I didn't miss a part. We can add this and ask her to put pressure on it. In front of her, we will make sure that we write up her test, her blood test, making sure we put the date, the time it was taken, her name, and that she's a female, and what tests will be done with her blood. We have to do a capillary puncture on her now. So with that, since we already took blood from this side of her hands, we will ask her to use this one. So for a capillary puncture, you can either do the middle finger, or the ring finger. The steps are the same. This will be done at the side of her finger. So what you do, you rub it to make sure that the blood is coming. And when it's pink and have the right color, you wipe. Leave that to air dry again. And we use one of these. Unscrew it. Bring your finger. And you pick her. Now once you pick her, the first sight of blood, we cannot use that for the test. This needs to be thrown back into the sharps container. We clean off the first sight of blood because we cannot use that. And then we squeeze. And what comes out the second time, that is what we're going to use for whatever test we have to do with the capillary puncture. When that is finished, once again, we clean it off, add some pressure, and ask her to add pressure to that. Once that is done, we did the same thing. We label everything that we need to carry to the lab to be tested. Once we make sure that we label it in front of her, we thank her and ask her if everything is okay and how is she feeling after the test. And that is the end of my presentation. So guys, thank you for watching. Any questions, you can feel free to ask me.